Respected judges, my dear colleagues and seniors, myself Dr. Rajesh Pattebahadur. I express my gratitude towards the AIOS for giving me the opportunity to present here. So, title for my case presentation is the HARBOYAN syndrome. It's a rare case report we find out. So, what we got a 13-year male patient which was referred from the pediatric OPD with a complaint of the blurring of vision. There was nystagmus and the right eye esodiation was present. Child was born out of the LSCS with a full-term delivery. He had a low birth weight history, but there was no an ICU admission for the 5 days, but with the no history of oxygen supplementation or prior or the current treatment for the ROP was not documented. Earlier ophthalmic evaluation was done on the local aspect, but no documents were available with us when the patient presented to us. So this was the ophthalmic examination. The BCVA in the right eye was 1/60, in the left eye was 6/36. Both eye had a nystagmus and right eye was having esodiation. Rest lead conjunctiva and sclera were within physiological limit. In the cornea, we found out that patient had a bluish haze. Endothelial edema was evident on the slit lamp. Corneal diameters were within approximately normal limits. IOP was not able to record it, but digital IOP was normal. Rest, anterior chamber, iris, pupil lens were within the physiological limits. So, what we got was a male child with a corneal haze with suspected endothelial disease. But there was a twist. The parent gave history that child was having a problem of hearing. So we did the ENT evaluation. On the ENT evaluation, BERA was done and we found out that patient had a bilateral sensory neural deafness. The right was having more, the right ear was affected more than the left eye. So we did these are the clinical pictures suggestive of, this is the pointer again. The picture on the other side showing the right eye having the bluish haze. The stroma was thickened, CCT was thickened, which was evident on the slit lamp. Other one is, this is the right eye, which has a less corneal haze, which corresponds to the BCVA, which we saw on the first slide. Again, the same slide, both are having the bluish discoloration and the corneal thickness was enhanced. This is an ENT evaluation, BERA report, which is suggestive of right eye moderate to severe hearing abnormality and left eye moderate hearing loss. So we did the literature research for any disease of the dystrophy which was affecting the endothelium plus sensory neural deafness, which was like corneal degeneration since birth and late onset sensory neural defect. So we found out the conclusion to be an HARBOYAN syndrome. So we made a diagnosis for the HARBOYAN syndrome for that patient. Now what is HARBOYAN syndrome? It's in the 1971, HARBOYAN described it. It's a rare genetic disorder. It could be caused by SLC4A11 gene located on the 20 chromosome. It can be X-linked recessive or the dominant. And CHED, congenital hereditary endothelial dystrophy, and HARBOYAN syndrome has many overlapping features where we see the bilateral congenital corneal endothelial dystrophy along with the bilateral progressive hearing loss. Generally, corneal involvement can occur by birth to the 16 years of the age, but most of the cases present within the first decade. Someone who has a abnormality in the hearing abnormality, generally the cases has a X-linked recessive presentation. In the ophthalmic features, generally patient presents with the bilateral clouding of the entire cornea. Within first year, central corneal thickness is increased. There is a epithelial and the stromal edema. Vision is severely hampered. That's why patient generally presents with a nystagmus. The histopathology of such cornea reveals the degeneration of the endothelial cells and the descemet membrane thickening. In the ENT aspect, we generally see the sensory neural hearing loss with the variable ages of the onset. Right and left eye may have a variable amount of the auditory loss, and it's a slowly progressive thing. It's not a stationary thing. So we came to the conclusion with the following DDs: CHD 1, 2, 3, 1, 2, Peters anomaly, scleral cornea, congenital glaucoma, Hurler syndrome. We can differentiate on the basis of that. What we did was we give the hypertonic saline artificial tear. We advise for the endothelial keratoplasty and genetic counseling since they were not available with us. Definitive treatment is a bilateral endothelial keratoplasty. For hearing loss, cochlear implant is the best thing. So take home message is awareness among the ophthalmologists and the ENT surgeon should be raised for the HARBOYAN syndrome to ensure the prompt treatment. Thank you.
Thank you. Nice presentation. Did you get genetic analysis done
for
this patient? No, ma'am.
Due to the financial constraint, we were not able to do. That was supposed to be done, but we tried, but There was issue with the patient lost to the follow-up, and for the financial constraint also, they were not ready for that.
Thank you.
How did you intervene?
What we did, so actually, ideally we should have done endothelial keratoplasty, but since that was not available with our center, so we had to refer that patient.
But the stroma?
Stroma was hazy.
Was it localized to endothelial disease or a stromal?
No, sir. Stroma was also involved. If you allow me to show, I can show the pictures. Just a second. This was for the right eye. The stroma was severely hampered. So endothelial keratoplasty is documented in the literature, but depending upon the involvement, where stroma or the anterior stroma is also involved, then we have to go for PK only. Endothelial keratoplasty may not help.
Most often congenital hereditary endothelial disease, they are often associated with the stromal disease.
Yes, sir. Yes, sir.
And we resort to PK.
Yes, sir. Yes, sir.
What was the age?
13 years, sir.
13
1
years.
3, yes,
So,
sir.
and it is since birth?
Yes, sir.
Presentation is
Yes,
since
yes,
birth.
sir.
Okay, so since 30-year patient was, stroma was edematous, so there are a lot of secondary changes to the stroma, as sir rightly said.
Yes, sir. Sir,
Endothelial
actually there
keratoplasty
was
is,
issue
and
that.
second thing is patient is phakic.
Yes, sir.
So again, endothelial keratoplasty is difficult thing to
Okay.
perform. So you can opt for
PK.
PK also.
Yes, sir. Yes, sir.
And better to go for one ASOCT, anti-segment OCT.
Yes, sir.
Did you perform?
Actually, sir, child was having nystagmus and he was not, I mean, even if you see, these are the blurred pictures. I apologize for that, but we tried a lot. That's after that only we could get this kind of pictures. Otherwise, he was very irritable and nystagmus was a main issue with that. Otherwise, ASOT, OCT was in the plan to capture.